I'm going to talk about sperm health. So we're going to talk about male reproduction, a bit of like anatomy and physiology, semen analysis and what that means and what it tests for, types of male infertility and the causes as well, and some ways to improve sperm health. First is male reproduction. So sperm is created in the seminiferous tubules within the testicle. Then it travels up, once it's created, it travels up through the epididymis, which is behind the testicle, through the vas deferens, which is a long tube that carries it the whole way through. It passes through the ejaculatory duct and prostate and picks up a fluid, which is semen, and then it continues through to the urethra. Now we're going to talk about semen analysis. Semen analysis is used to assess the quantity and the quality of men's semen as an assessment of their fertility, and it's collected after 3 to 5 days of abstinence, and usually if it's done via the GP will be sent off to a lab that's attached to a fertility unit, and it measures the volume in mils of the semen in the sample, the pH level, the concentration, which is the physical number of sperm per mil within the semen, the morphology, which is the size and the shape of the sperm. Are they big? Are they small? Have they got 2 or 3 heads? The motility is the ability of sperm to swim. Can it swim straight or does it go all over the place? And the liquefaction, which is the amount of time it takes to change from semen to a clear, like liquid fluid. That's what happens in the vagina. And the vitality, which is the amount of alive sperm which is in the sample. At-home test kits, so your Exceed, Mojo, the ones that you can buy in Boots, those sorts of things, they tend to measure only the concentration, motility if it's done via a camera, and the volume as well. So usually if a couple have been trying for longer than between 6 to 12 months, then it's better to send them to their GP for a full semen analysis rather than just the Exceed, Mojo. If, however, they've, just starting out, they're just doing their tests to see if everything's okay right at the beginning, then these are appropriate. So moving on to the types of male infertility. So male factor infertility is thought to either contribute to directly or be the primary cause of 50% of all subfertile couples. So anybody that is struggling to conceive, half the time it's the woman and half the time it's the man. There's not a lot of focus on men's fertility, and it tends just to be that the woman has got the problem. So it's always good to know about these sorts of things. The main types of male infertility, you've got azoospermia, which is no sperm whatsoever in the ejaculate. Teratozoospermia, which is a high number of sperm with an abnormal shape, so your 2 heads bigger or smaller than they should be. Oligozoospermia is a low amount of sperm within the semen, so a low concentration. And then asthenozoospermia is reduced motility of the sperm, so they're not as fast swimmers as they should be. Moving on to causes of male infertility. So you can categorize causes of male infertility into two sort of subsections. You've got obstructive and non-obstructive. Obstructive is caused by a physical obstruction blocking the passage of the sperm coming out. So your examples of that would be a vasectomy, where the vas deferens, that long tube, is cut or tied to stop the sperm coming out of the urethra and penis. The varicocele, which is an enlargement of a vein within the testicle, almost like a DVT within the testicle, but not quite. The evidence surrounding that being a contributing factor to infertility is a bit here and there. It's not definitive, but it is thought to be one factor. Inflammation or infection in the epididymis, which is the bit behind the testicle, and cystic fibrosis. Any man with cystic fibrosis doesn't have a vas deferens. It's just a congenital abnormality. So that leads to infertility. Then your non-obstructive infertility, you can kind of categorize it out into endocrine disorders or genetic. So there is a syndrome called Klinefelter syndrome, and quite often it's not, a man doesn't know that they've got it until they start to try to conceive. They're born with an extra X chromosome, which can affect testicular growth and make their testicles smaller, and therefore their production of testosterone is smaller as well, which can cause reduced muscle mass and enlarged breast tissue. So they've got quite a distinct sort of look, and there are ways like little soft markers to see. And I've put cystic fibrosis in there as well. Testicular defects or failure. So men that have got abnormal semen analysis, but there's no identifiable cause, they often have high FSH or low testosterone, similar to women who are sort of moving towards the perimenopause. They would have a higher FSH and a potentially lower estrogen. And idiopathic, where it's a man is infertile and not producing a pregnancy but has normal semen. So that's unexplained infertility. So just moving on to ways to improve sperm health. So supplements. Yeah, there's not a lot of like concrete evidence that says that you should take these supplements or you shouldn't. It is thought that selenium, zinc, omega-3 fatty acids, CoQ10, and carnitines or carnitines, I can't work out how to pronounce that, they are thought to benefit sperm quality parameters, which is semen analysis. But that was specifically for men not undergoing treatment in a fertility unit. A Cochrane review did find that the use of antioxidants in men that are undergoing fertility treatment didn't increase live birth rate, so didn't have much of an effect. The majority of people that we speak to aren't under the care of a fertility unit, so it's an appropriate recommendation to suggest that they supplement with those supplements, the selenium and the zinc. You can also find them in diet, which is potentially an easier way of taking it than taking so many supplements. So a high fat diet can reduce sperm concentration, motility, so how much sperm there is, how fast they're swimming, and DNA integrity as well. And that's the same with red meat as well. So a diet high in fat and red meat isn't so good. Like with women, sticking to a Mediterranean diet is good for men. So fruits and vegetables, fish, legumes, omega-3 fatty acid, all linked to better sperm quality. So the next one is lifestyle. So exercise is good for sperm. Exercising for an hour 3 times a week has been seen to increase all sperm parameters. So it helps sperm concentration, speed, that sort of thing. Interestingly, though, cycling for more than 5 hours a week has been associated with lower motility and concentration of sperm. I don't know, and it didn't say whether that was to do with the pressure, the sort of situation down there, or lycra usage. We're not quite sure. But that does segue nicely into the role of tight-fitting underwear. So wearing tight-fitting underwear is associated with an increase in scrotal temperature. One study, again, with a lot of these studies, one says one thing and one says the other. So one study found that it does increase scrotal temperature and it can decrease sperm quality by up to 50%. And that was compared to a tight-fitting underwear group versus loose underwear. But that study only had 20 participants and was conducted a quite a long time ago. So others have found no significant difference, but I've kind of said that, you know, it's not going to do any harm. We know that it won't do any harm to suggest wearing loose fitting underwear, so it's safe to sort of recommend, even though we don't know if it's going to have any benefit.